Hello and welcome to our series of podcasts brought to you by Business Kirklees and the Kirklees Top 100 Initiative. We can't wait for you to hear about the rich history of businesses in our region, their heritage, innovation, research, development and growth. Kirklees has a diverse industry base and its central location means it's a great place to live and work with fantastic transport links to key cities and networks across the UK. In this series, we highlight businesses and celebrate the positive impact their success stories have on the great people, places and communities of Kirklees. Hello and welcome to the Kirklees Top 100 podcast. Joining me today, I have a wonderful guest, Claire Paxman from Paxman Scalp Cooling. She has a fantastic story to tell us about her incredible business that has grown exponentially over the last 25 years. Hello, Claire. Thanks for joining me.
Hello, Ellie. Thank you very much for having me.
So can you tell me a little bit about yourself first and a little bit about the business, and then we're going to go into your story, which is so personal to you, isn't it?
It is, yeah, it is. So thank you again so much for having myself and having this opportunity to talk all things Paxman, which is absolutely the favourite thing of mine to do. Yeah. So I'm one of the family members of the founders of Paxman Scalp Cooling. Mm-hmm. My official title, if you like, it's rather a grand one, but yeah, it's brand ambassador and director of global training. Mm-hmm. Really, in a nutshell, I have a huge passion in educating people, in ensuring that they get the best treatment. So if you're a clinician providing the treatment, or if you're a patient receiving it, so that's myself, and that's what I do within the business. So Paxman Scalp Cooling, we are a medical device business located in Huddersfield. And we manufacture a device that helps to minimise hair loss through chemotherapy treatment. We're really proud to be doing that, and to be a global business, and to be globally changing the face of cancer.
Yeah, and you really are. I mean, incredible. From Huddersfield.
Yeah, from Huddersfield.
Yeah. I mean, and that's why it's so important to get the word out, because we've got such amazing businesses here in Huddersfield. So originated from Huddersfield. Can you tell me how the business started, how it came to light? Because I know it's such an incredible story. And you can see on the website the video that's going to tell me a little bit more.
Absolutely. So the reason that Paxman started is because of my beautiful late mum, Sue Paxman. She was diagnosed with breast cancer when she was only 36 years old, back in the early 90s, and the prospect of losing her hair absolutely terrified her, just like the majority of people all around the world now. It really did worry her so much. So my mum actually did use an older type of a rudimentary type of scalp cooling, because scalp cooling has been around since the 70s, varying different forms. But the one that my mum used, unfortunately, it didn't work for her. My own personal story of that is I actually cut her hair off when I was 14, stood in the bathroom with those orange-handed scissors from the kitchen, and it was already coming out in clumps, but
something that you'll remember forever.
Honestly, Ellie, it's just I will never ever forget that moment. It's one of the worst things that I've ever had to do, and it's what gives me the passion and drive to want to make a difference and to want to help so many people to not have to go through that. So at the time, my dad was there, Glenn Paxman, who's our founder and chairman, and he was with my mum when she was having a treatment, with my mum when she was having this type of scalp cooling. And my dad's already a very successful businessman and entrepreneur, a deep understanding of cooling as well.
Yes, we haven't mentioned that bit yet, have we?
No. So as a family, we've been cooling liquids for a very long time.
Yes.
And that sort of dates back to my granddad, Eric Paxman, and he actually invented the first type of ice bank beer cooler. way back in the 1950s.
Wow.
So yeah, as a family, we've been cooling liquids in the drinks dispense industry, and we still are now. We still do are to this day. So when my dad got to see that my mum was obviously distressed, but was trying this scalp cooling, he was inquisitive.
Yes.
You know, like what?
An engineer.
Yeah.
Yeah.
Just like, what are you trying to do? Why are you trying to cool the scalp? What's happening? And when he was advised that, you know, they had to reduce the scalp, or they were trying to reduce the scalp to limit the blood flow to the actual scalp, which is carrying the chemotherapy, to try and protect those hair follicles. But all the methods currently were very time consuming or had to be changed, and it was about maintaining that scalp temperature. That was when as I say all the time, but
we cool beer.
Yeah, absolutely. So I can cool heads.
Yeah.
And you know, and it was his light bulb moment. I thought, hang on a minute, I can make something that works. But the biggest motivator for him was just seeing how distressed my mum was.
Yeah.
It's the first time she cried. When her beautiful curly hair, you can
like your
see
curls.
what's just that's who I get my curls from.
Yeah.
And my mum's was blonde, and you can see on a video that we play on our
on the
website, our story, you can see
very poignant.
Yeah, videos and pictures of my beautiful, beautiful mum. And, you know, she was devastated. It was her the biggest part of her. It's what people recognised her and knew her for. So when she started to lose it, it just, you know, she could cope with the diagnosis because she didn't cry when she was diagnosed or when she had to have surgery.
Wow.
It was when her hair started to fall out. That was when she really found it so difficult. So that was the biggest motivator for my dad to say, I've got to make something that works.
Yeah.
It's got to work.
And knowing from that how many other people have been helped by this.
Absolutely.
Yeah. So that's how it started. That's your passion. That's what's driven you and is still driving you, really, isn't it?
Yeah.
All these years on. But the growth that the business has seen is quite remarkable as well. So tell us a little bit about that.
Yeah, it is incredibly remarkable. So yeah, we got medical device approval in 96, 97, and that's when we got our first systems into hospitals. One was Huddersfield.
The first one was Huddersfield, wasn't it? Yes.
And the Christie. But we, you know, back then it was a brand new market to us. We didn't have any clinical data, which is really what we needed. But people could see the benefit because we got a refrigerated device, and you know, you didn't need to change the caps. So we've, over the years, the growth has included where we've, you know, to put more systems into the UK, which has kind of been the blueprint for us being able to enter into other markets.
Yes.
But it's sort of been the last 10 years where we've really seen the growth and the growth in the business, in our footfall in all over the world globally, and also our people. Yeah. So in April 2017 was an incredibly proud moment when we gained FDA clearance. So the FDA is for the USA market. So we could market Paxman devices in the US, which is one of the largest healthcare markets. Yeah. Again, we had to do a multi-center trial, you know, investment as well. That's why, as a business, we actually went public on the first NASDAQ in Sweden. And then from there, again, we've been able to grow even further, to the point where, as I sit here now today, we are distributing to over 65 countries, 65 markets globally. We have nearly up to 6,000 systems worldwide. We've treated hundreds of thousands of people, and our team were nearly 100 people at Paxman, which is just crazy. Yeah,
you mentioned those calls that you have with the team when it.
So we have a monthly. We pride ourselves on our people.
Yes.
And because we're now global, we are in a number of markets internationally. So we have our team in the US, we have team in Canada, we have our direct markets, France, Spain, Germany, India, Scandinavia, and so we want to make sure that everyone feels included.
Yeah.
So we do monthly buzz meetings, and so when everyone's on there on the screen, it's like, I think I refer to it, it's like celebrity squares on steroids.
Celebrity squares, that's it.
It's but it's lovely.
Yeah.
It's so nice to see everybody's faces, and we usually put the spotlight on somebody. It might be a member of the team. We had one from our purchasing department, what a day in purchasing looks like.
Brilliant.
Because we don't, just because you're not at our HQ in Huddersfield, doesn't mean
Still
that
want
you
them to
can't feel part of the family.
Yeah.
And it is, our foundations are, and what we're rooted from is Paxman family.
Yeah.
But then now that extends out into every single person at Paxman, and we're really proud of the people that we have.
Yeah, technology is amazing now, isn't it? How we can communicate across the world so quickly and easily, and COVID sort of contributed to that. It
absolutely did massively, and also helped us as a business for our people because we now have a hybrid approach as well for working. So you can work from home or you can come into the office, and we do encourage that as well, particularly for our team that are located elsewhere in the country, so they can come and feel part of it as well. But it's really important. But that's enabled us to employ people and look outside the Kirklees area.
Absolutely.
But it's bringing investment and people into Kirklees as well.
Yeah, which is absolutely fantastic. Could you ever have imagined, in the late 90s, that it was going to amount to something on this scale?
Gosh, well...
Or you're going to say yes, absolutely.
Yeah, of course.
And I mean, you've global domination.
Yeah, we want global domination. But, of course, that's always your dream.
Yeah.
But when it's happening, it of course it does. I keep saying these pinch me moments of where we've come from. Yes. I've worked for our family businesses for 26 years now, and I started out on Brewfit, our sister company that's still in the drinks dispense industry.
Yes.
And my two other wonderful brothers,
siblings,
Curtis and James, they run that side. And then Rich, my brother, is our incredible, fabulous CEO of the business. His leadership is wonderful, and then I'm so proud as well to be on the SLT with my other colleagues as well. And it's I love it. I genuinely love it. But then there's times when you're in meetings and we see where we're going and what's happening and what we're doing, and you're just like, oh my goodness.
Is it really happening?
This is incredible. But then I have a really lovely moment just to think, wow, how proud.
Yeah, you must be.
Must my mum be.
Gosh.
She sadly died from secondary breast cancer after a reoccurrence. And then in October 2000, she was only 44 years old. Gosh. I've surpassed her age now. But the legacy that she's left and what we're doing on a global scale is just, I'm trying not to get emotional.
And it must be hard, but always knowing that this is this was the reason you've always got your mum there, really, haven't you?
Absolutely.
This is the reason it was all set up. And also it's a whole family business, isn't it?
Yeah.
And doing this for mum, I just think, gosh, what an incredible story. And to have that passion and that drive, as a family, it really is incredible. What a story!
It is, and again, I always say I'm so proud that I get to do this with Rich.
Yeah.
My dad, I know he's like sits back and thinks, if we wouldn't be here if it wasn't for him and his brilliant idea of developing this. But now, to be.
What's your dad's involvement now then?
So he sits on the board.
Yes.
But operationally, it's Rich who runs the business.
Yeah.
But he's still a consultancy and still involved. But we're also trying to encourage him to sit back.
He can relax a little bit now.
Absolutely. You've done an incredible job over the years, and as I've just said, he wouldn't be here now.
And how wonderful for him, knowing that you guys can all,
it's in good hands.
It's in good hands.
You keep
telling him.
But no,
Fantastic.
it is fantastic. And as I say, the senior leadership team that we have is they're incredible, and all the team at Paxman.
Yeah.
You know, we're really proud of. We actually recently we complete engagement surveys at Paxman because we want to ensure that we are looking after managing, leading, that our team feel involved. So we do complete engagement surveys, and we actually, the last one was, we had 95% completion, which the company that run these, actually we were highly commended because the average is around 72%.
Wow.
Yeah, so we
95%,
and you know, the majority, in fact, more or less everybody said that Paxman was a great place to work, and that's so important for us. Yeah.
And I know it is all about your people as well, isn't it?
Yeah.
And you're investing in your people.
Yeah.
So you work closely with Kirklees, don't you? And so there's a few things there that they've helped you with, and specifically I know the growth manager there, Rachel Felbeck. She's fantastic. Tell me a little bit about what you've done together with Rachel.
Yeah, so with her being our growth manager, she's introduced us, helped with the R&D funding, but also more so investing in our people as well. So introduced us to the apprenticeship. Thank you. Brain block then. Apprenticeship levy, because that's important for upskilling of our people as well. And that's not necessarily, it's not just about the apprenticeships for school leavers. This is actually upskilling your team. So we've had access to some fantastic apprenticeship schemes, which currently there's a number of our teams, some people who, you know, have been working for us for a long time, but are actually, again, as I say, upskilling,
learning
with this,
in something else that they might not have previously maybe had an interest in, but it comes a bit later on. And not a lot of people know about that, because you think of apprentices being, you know, 16 or 18, but being able to do that later in life. So having a connection, I guess, with Kirklees, and then being able to help you and guide you in that direction.
Yeah, no, that's been wonderful. And then also that's led us on to being involved with West Yorkshire Combined Authority, or WYCA for short, and their Fair Work Charter as well. So we're now partnering with that, and that's to, again, improve and ensure that all your people are being looked after. So that's something that's really, really important, because, again, you know, I've just mentioned about the buzz meetings. We're also really invested in diversity and inclusion. So we have quarterly diversity and inclusion meetings, again, globally. So we started off with subjects, and now we're actually inviting people in to talk on different subjects. So race, LGBTQ, all different disabilities, all different areas. So that's super important for us. We also allow people days off to go and volunteer.
Amazing.
And health and well-being as well is really paramount to us. We have monthly mental health drop-ins. I'm a big advocate for mental health. I live with a mental health disorder myself. I'm one of the people that actually facilitates those drop-ins, as well as a few of my other lovely colleagues. You know, that healthy work-life balance is really key and paramount.
It is amazing, isn't it, that people are really recognising that now. Nowadays, it's so great to see that we're moving that way, and that you advocate it in your business and throughout. How do you find time? that you're so busy. So all
Not
of these
enough
things,
hours in a day.
I know, and having that, I guess, that senior leadership team as well is so important. Amazing. And then also a bit about you've worked with Huddersfield University for quite some time, really, haven't you?
Yes,
Research
we have.
and development.
So the partnership has been pinnacle with the Huddersfield University over the years. So it's about 10 years, the relationship now. So we initially started the partnership with the KTPs, which are knowledge transfer partnerships, which is government funding, where they link academia and enterprise together, and it helps with your research and development. So we worked initially with the design and development department in improving our CAPS. So we were able to access 3D printing, lots of materials, and again, anthropometric testing on different head shapes. And then also with the biological and sciences department, we could actually highlight the credibility of,
Right,
or they've been pinnacle in the credibility of scalp cooling. So we've done lots of research in terms of the temperatures, the correct temperatures, or the that sweet spot of temperature, what the scalp needs to be in order for it to work effectively.
And this takes years and years, doesn't it? This sort of research that you've got to do.
It does, yeah. And obviously there's the funding and everything as well. So it was really great for us as a business for it to sort of come round threefold or a full circle moment back in 2019 when we were able to reinvest back into the university and actually open the world's first scalp cooling research and innovation centre.
The world's
first scalp cooling research and innovation centre. So that really heightened up our the biological work that we were doing with Dr. Nick Georgopoulos, and we started cultivating real life hair follicles so that we could actually see exactly what happens to them when you deliver chemotherapy to them.
Tell me, because you did tell me, and it's fascinating.
Oh, how it works?
Yes.
Yeah. So this is your science lesson, folks.
It's
Science
really
with Claire. Gosh, no, not really. But yeah, so the reason you lose your hair when you have chemotherapy is because a cancerous tumour is a fast dividing cell. It's constantly growing and evolving. So your actual cells in your hair follicle are also a rapidly dividing cell. So the difference is that when you are given chemotherapy, what that does is it searches out and targets rapidly dividing cells, obviously to kill them off. But it can't differentiate between a healthy cell and a nasty cancerous cell. So it just targets them all. So that's why you lose your hair. That's why you've got fast dividing cells in your mouth, in your stomach. So people have issues with those areas as well when you're having chemo. So ultimately what we're trying to do is protect those hair follicles from the chemotherapy. So there's a number of different biological mechanisms occur when you reduce the temperature of those cells to around 18 to 22 degrees Celsius, and that's plus. So there's a common misconception that we freeze the hair follicle and we freeze the head. That's not the case. It's actually around 18 to 22 degrees. And as I say, there's lots of mechanisms that occur. So the first one, and which has always been the traditional thought and process to try and achieve, is vasoconstriction. So vasoconstriction narrows the blood vessels and limits the amount of blood getting to that chemotherapy, getting to the hair follicle that's carrying that chemotherapy. So it reduces it down to 20 to 40%. What we've also found as well is that the cells themselves, when they are cooled, because they're energy driven, they actually slow down. So they stop rapidly dividing. So that means then that the chemotherapy bypasses them. We've also then found in the lab is that, again, when you cool, the way that the chemotherapy enters into that cell is the fluidity of it into the cell is also lessened. So the chemotherapy can't actually get into, or less chemotherapeutic drug again actually diffuses into that cell. And then the final point as well is that the process of the chemotherapy and how it actually if you like, destroys that cell or kills that cell, the toxicity of that chemo is lessened when it's in that cell itself. So lots of different processes are happening. We do see varying different levels of results in terms of efficacy. With a drug category called taxane, we see much higher levels of efficacy. Anthracyclines is slightly less, but again, that's because of how the way that it targets those cells. So one of the other things that we've been working on, and again that Dr. Nick has been highly involved with, is actually the production of a topical agent. So our R&D we invest heavily in. We have now a 6-7 strong R&D team. You know, it's paramount for us again to to both invest
Yeah.
and innovate
Yes.
to improve patient outcomes.
Yeah.
That's so important. So that's what our R&D, and that's our future focus as well for both equipment, caps. But this topical agent is basically it's a topical agent that will enhance the scalp cooling process.
Yeah.
So by ingesting into the skin, it's an antioxidant. I won't go into too much scientific detail, but basically that will be ingested into the hair follicle.
Yeah.
And then with the cooling process,
Together.
it further protects it.
Yeah.
So in the lab, or is also known as in vitro,
Yeah.
we've seen some fantastic results.
Yeah.
So our next stage is to go on
constant,
to is the next stage is the actual product. How do we get the product into the hair follicle, and then obviously human testing. So
Constant innovation, constant research and development. You can see how much work goes into that, and you've had so much growth in the last 10 years. But prior to that 10 years of getting to that point, it's just ongoing, and it's incredible to see for the future that you just want to keep improving, you want to keep getting better. New products maybe that are coming out for different things as well. So that's mind-blowing. I can't imagine the technical side of everything is just mind-blowing, but ultimately at the behind it all is just this passion to help people, isn't it, that are going through cancer treatment, chemotherapy.
Yeah, absolutely.
Yeah, it really is amazing. So Claire, so you've gotten to this amazing point within the business. You are the world's front runners, really, in the industry, aren't you?
Yeah.
So tell me, what does the future hold? Where are you going? What's next?
The future is incredibly exciting. So I've already mentioned about that we're investing heavily in R&D, and that is actually including a new device as well that we have developed. So we've been working with the University of Singapore for the last three years on a device which is helping peripheral neuropathy, which is another really debilitating side effect of chemotherapy.
Right.
So we are currently trialling that in Singapore and also across 22 sites in the US.
Amazing.
So there's innovation with that, improvements with that, and then for us going to market as well. So I'd already alluded to as well, we are much more investment in our direct markets. But we as a company, as part of the investment zone, with a third investment zone announced in West Yorkshire. So we are really involved with that, and Paxman will be actually investing £5 million to develop our innovative medical devices, which will put us really at the key, and will hold West Yorkshire as one of the key innovative areas on the map as well. So we're really, really keen to and proud for that as well. Yeah,
you must be. That's absolutely incredible. So really, so much more. Still those huge goals.
Yeah, absolutely.
Yeah. So never stop.
No, absolutely not. The thing is, we want to democratise scalp cooling. Make sure that no matter who you are, where you are in the world, that you get access to this, whatever your gender, your ethnicity, and your financial situation. So all of this investment helps that and to grow, but then also to expand our devices so that we can be synonymous with cryotherapy of chemotherapy induced side effects management. So that's
all
key
over the world.
All over the world.
All over
right
the world.
Here from in Kirklees.
Yeah, it really is an absolutely incredible story. Your mum, oh my gosh, would be so proud of all of you. It really is incredible and amazing to hear. That's what's constantly driving you.
Yeah.
Thank you so much for sharing your story with us today. I think our viewers will just be inspired, blown away, and it's great to hear that we've got all of this going on in Kirklees. It really is fantastic. Thank you so much for joining us today, Claire.
Thank you.